Hello everyone, welcome back to my YouTube channel Dr. Barkis Ophthalmology Tutorials. Today we will discuss about the syndromes which are associated with 6th nerve palsy. So I will be discussing about the syndromes which are associated with the 6th nerve palsy depending upon the anatomical location of the abducens nerve. Like we have so many syndromes when the affection is at the level of brainstem. When it comes to subarachnoid space, there is no specific syndrome name, but I will be discussing what happens when the nerve is affected in the subarachnoid space. Okay, without much delay, let's begin our video on syndromes which are associated with 6th cranial nerve palsy. So when the lesions are at the level of the brainstem, we have mainly three syndromes, that is Raymond syndrome, Millard-Gubler syndrome and Foville syndrome. So what is Raymond syndrome? So here the lesion is at the level of the fasciculus part, which involves the pyramidal tract also. So there is 6th nerve palsy along with contralateral hemiparesis. Coming to Millard-Gubler syndrome, here the lesion is at the level of the ventral part of the pons and the patient will have 6th nerve palsy, ipsilateral 7th nerve palsy, that is UMN type again, and contralateral hemiparesis. We have Foville syndrome. Here the lesion is at the level of the dorsal pons, which affects MLF, PPRF, 5th nerve and the sympathetic neurons. So the patient will have symptoms of 6th nerve palsy. There will be horizontal gaze palsy, ipsilateral, 5th, 7th and 8th. So you can remember it as continuously there will be involvement of 5th, 6th, 7th and 8th cranial nerves here. So you can remember it as Foville syndrome, where F stands for 4 cranial nerves. So 5th, 6th, 7th and 8th cranial nerves are affected along with the ipsilateral Horner syndrome. When the lesion is at the level of the petrous apex, so here as the nerve passes in the Doralus canal, its contact with the tip of the petrous pyramid makes it vulnerable to few infections, which will lead to the syndromes known as the Gradinego syndrome. Here the lesion is at the level of the petrous apex, as I told. So here there is inflammation or extracellular abscess following otitis media. The triad of the Gradinego syndrome is 6th nerve palsy with a decreased hearing because of 8th nerve involvement and ipsilateral facial pain in the distribution of 5th nerve. So that is the triad, and sometimes the patient can also have ipsilateral facial palsy. We have one more syndrome called as pseudo-Gradinego syndrome, where the symptoms will mimic the Gradinego syndrome. But here the 6th nerve is affected in a different way, like in case of CPA angle tumors like acoustic neuroma or the meningioma, there is 6th nerve palsy and there is involvement of the 8th nerve, so there is decreased hearing and the vestibular symptoms. Here the first symptom is decreased hearing and the first sign is decreased corneal sensation. Therefore, these two things must be checked in any patient who is presenting with 6th nerve palsy. That is, check for the hearing loss and check for the corneal sensitivity. Then maybe the pathology is acoustic neuroma or the meningioma. The second thing which mimics this Gradinego syndrome is the nasopharyngeal carcinoma, which can obstruct the eustachian tube leading to serous otitis media, and sometimes the CA itself can invade the cavernous sinus leading to 6th nerve palsy. So these two are causes for pseudo-Gradinego syndrome. Coming to affection of nerve in the subarachnoid course. So here the nerve is affected as it ascends the clivus and turns 90 degrees anteriorly to enter into the Doralus canal. So any change in the intracranial pressure, either increase or decrease both, can lead to downward displacement of the brainstem, stretching of 6th nerve as it is firmly adherent when it exits the pons and inside the Doralus canal. So that is the reason for the non-localizing sign of the 6th cranial nerve palsy. And 30% of patients of IH, that is idiopathic intracranial hypertension, can have only 6th nerve palsy as the only neurological deficit. So other things which you find in IH are like papilledema, visual field defects. There can be normal or small size ventricle, but sometimes only the 6th nerve paresis can be a sign of IIH. Now moving on to the course of the 6th nerve in cavernous sinus. Here the 6th nerve can be associated with 3rd, 4th or 5th cranial nerve palsy. In the 5th, again it's the ophthalmic or the maxillary division of the 5th cranial nerve. So what are all the conditions in which the intracavernous part of the 6th nerve is affected? So it can be affected whenever there is intracavernous internal carotid artery aneurysms, there is carotid cavernous fistula, or if the patient is having Tolosa-Hunt syndrome, or even the meningioma of the medial aspect of sphenoid ridge. So if the patient has intracavernous internal carotid artery aneurysms, then 6th and 3rd cranial nerves are most commonly affected. If the patient has CCF, there is arterialization of the venous blood, So the patient will have pain, proptosis, bruit, ocular pulsation, red eye, chemosis, tearing and even the double vision. Here sixth nerve is most commonly affected, which is followed by third, fifth and fourth. Coming to Tolosa-Hunt syndrome, it's very non-specific inflammation of the cavernous sinus or the superior orbital fissure. It is most commonly recurring and relapsing type. The hallmark of this syndrome is it is being painful. Again, it affects third, fourth, sixth and the trigeminal nerve and the sympathetic plexus with or without the involvement of the optic nerve. The meningioma of the medial aspect of the sphenoid ridge. Here again there is sixth nerve palsy. There can be exophthalmos, there can be visual field defects, monocular blindness and even the functional scotoma. Coming to the orbital syndromes which are associated with sixth nerve palsy. Here the sixth nerve is affected secondary to tumors of the orbit like orbital pseudotumors. It can be secondary to thyroid eye disease and the orbital cellulitis or the myositis. Present with conjunctival congestion, there can be optic nerve involvement, the frozen globe, the corneal sensation is decreased because of the trigeminal nerve involvement. And there can even be isolated sixth nerve palsy also. So to summarize, just to list out the syndromes which are associated with sixth nerve palsy, we have Raynaud syndrome, Maillard-Gubler syndrome, Foville syndrome, Grady-Negro syndrome, pseudo-Grady-Negro syndrome, Tolosa-Hunt syndrome. So these are the 6 syndromes which are associated with sixth nerve palsy. To repeat again, Raynaud syndrome, Maillard-Gubler syndrome, Foville syndrome, Grady-Negro syndrome, pseudo-Grady-Negro syndrome, Tolosa-Hunt syndrome. So hope this video on the syndromes which are associated with sixth nerve is helpful to all of you. If you like my videos, please do subscribe to my channel. Press the bell icon for further notifications. Please do like and share my videos. Thank you so much.